Is this the right decision?
Yes. And it was always a strategy to try to encourage more people to get vaccinated. And that was obvious from the start. And it would make a nonsense to sack 70,000 healthcare workers, although I never really understood why the non-frontline workers were included in that. But can I just say, Julia, I also don't agree with vaccine refusal. I'm required to have vaccinations against MMR, which in itself some people find controversial, chickenpox, BCG, and hepatitis B, which is 3 vaccines. And bear in mind, hepatitis B is a genetically engineered vaccine, okay? Those are requirements. No one in this debate has pointed out that compulsory vaccination has been in the health service for many years.
No, lots of people have pointed it out. I'd like to point out that virtually all of those you mentioned are normal childhood vaccines, very long tried and tested vaccines with long-term, we know very, very clear benefits. You look, there are very few people in this country who haven't had those. The MMR, anyone who is concerned about the MMR, frankly, ain't done their research and frankly need to stop Googling nonsense from people who don't know what they're talking about, including Andrew Wakefield, who I think, frankly, should be in prison for some of the things that he said. I think he would have cost children's lives. Hepatitis B, very different. Hepatitis B is about protecting the staff from patient with hepatitis B, and it's not legally mandatory at all. And if you've got antibodies to hepatitis B, you don't have to have hepatitis B jab. That's not the same with COVID. We've spoken to, and we're going to speak to in the next hour, Steve James, the NHS consultant who confronted Sajid Javid when he was in his hospital and said, look, I've worked in a COVID ward. I've been exposed a million times. I had COVID at some point. I don't even remember having it, but I've got the antibodies. Why do I need to have this jab? And it's a fair point, isn't it?
I absolutely agree. And I made the point on Talk Radio that if you've got immunity, there's no need to have the jab. Having said that, a lot of the people not having jabs have bought into conspiracy theories, which I don't think healthcare workers should be doing. And secondly, and I've seen this in first-hand cases, it's been estimated about 10% of people who don't want the jabs are doing it because of needle phobia. So I don't mind people talking about body autonomy, and I take your point about the other vaccines. I will add in that every year at my appraisal, I'm told to have a flu vaccination, and flu vaccines can cause Guillain-Barré syndrome and other side effects. But I go along, I do what I'm told because I do a lot of things for healthcare that I don't want to do, but I do it because that's what I think is the right thing to do.
But the interesting thing is that even over the weekend before this announcement we're expecting today, we'd had this, the CQC, the Quality Care Commission, they basically said, Care Quality Commission, that, look, a hospital where they can show that they are so short of staff that sacking staff for not being jabbed will actually cause a bigger problem and bigger risk to patients than having staff who are unjabbed on the wards, that they won't have to sack staff. Well, that's pretty much the whole of the NHS anyway,
exactly,
isn't it?
Exactly. And of course now, with Omicron as a mild variant, everything's changed anyway. But I do think it was right to encourage healthcare workers to be vaccinated, mainly for their own protection. As you know, the vaccine doesn't prevent transmission, but it does stop people getting seriously ill. And listen, the health service is their employer. If you employ people, it's your duty to stop people getting seriously ill. And if someone's going to spend 2 months in hospital because they've had COVID, as their employer, the health service has an obligation to advise them very strongly to get protected. I don't agree with the healthcare workers who have refused point blank to consider this vaccination. I think the government's making the right decision to reverse a mandatory vaccination.
But you still think they should have. The interesting thing is, we've spoken to Steve James, NHS consultant, and another NHS consultant at the end of last week, and neither of them are sort of anti-vax. They've had all their other vaccinations, no issue at all with that, but they're both of the view that, they don't need to have this vaccination, and we shouldn't be having vaccinations we don't need. Happy to have them if we need them to protect us, protect others. But, again, things like hepatitis B, that actually is proven. It's long-standing safety information, but also it's proven to prevent transmission.
Yeah, but when it first came in, I worked in genetic engineering. I worked on a hepatitis B vaccine. It first came in as a new genetically engineered vaccine. And I don't remember anyone making a fuss about it. Yes, we've had 20 years experience with it, but when it first came in, there was no fuss. And you have to have at least 3 vaccines. The main point I agree with you on is the immunity. Okay. We do hepatitis B immunity tests. If you've got COVID immunity, there's no need to have a vaccine, although you and I have had both COVID and vaccines. But there you go.
Yeah, well, again, at the time, it was thought that it could help prevent transmission on a far greater basis. And I thought, again, for the sake of, elderly relatives and things, it was something I would do my bit for. But I don't think kids should have to do their bit. I think it's different for adults. But there we are. Really good to talk to you. Thank you for joining us, Dr. Laurence Gerlis.